Hey there, it's open enrollment time, so let's talk about how to pick the best plan for 2024 and talk about some options off the marketplace as well. As always, remember, if you have questions, you can reach us in the comments below or at the number on the screen, and of course, there is no charge for our services. To pick the best plan, you need to make sure you're getting the best bang for your buck. So let's talk about some of those associated costs. Your premium is the amount you pay monthly to keep your insurance active. For marketplace plans, you may be eligible for a premium tax credit depending upon your income and your household size. Marketplace plans will ask you to estimate your MAGI, or Modified Adjusted Gross Income, for the upcoming year. It's basically your AGI with a few extras thrown back in. So this is the income that you would put in when you file your taxes. Now, it's very important that you estimate as accurately as possible. And yes, I do know that can be a little bit tricky. If you underestimate, then you may make yourself eligible for a larger premium tax credit, but not really, and you would have to pay a portion of that back or maybe even all of it back when you file your taxes. Remember, they aren't going to ask you about any of your assets or bank accounts. They're really just looking at your income. Now, it's very important that should things change, if your household size changes or your income, that you update your information so you're not confronted with an unwelcome surprise come tax time. If you're eligible for a premium tax credit, and many people are, you will see that reflected when you're comparing the plans. You will see your price, and underneath that, you should see what the original price is now with your discount. Then there's your deductible. This is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. Now, with marketplace plans, there are some exceptions to this. There are many services that are covered before you meet your deductible, namely preventative and wellness services. And of course, those are going to be included in your 10 essential benefits. More on that in just a moment. Remember, plans with higher deductibles tend to have lower monthly premiums, and plans with higher monthly premiums tend to have lower deductibles. So there is usually an inverse relationship there. There's also such a thing as a high deductible health plan that has its own benefits that we're going to talk about later in this video as well. Now, once you've met your deductible, you'll be responsible for copays or coinsurance. A copay is a fixed amount. For example, on your particular plan, it might cost you a $50 fixed copay to see a specialist. You might also have a coinsurance, which is a percentage of the cost. For example, let's say your plan had a 40% coinsurance for an emergency room visit. Well, if it would ordinarily cost $1,000, 40% of that would leave you with $400, and that would be your coinsurance. As you continue to spend, you may reach your out-of-pocket maximum. Of course, we hope that's not the case. Out-of-pocket maximums are there to protect you from major medical bills. So depending upon what you end up spending in a given year, you may or may not reach that out-of-pocket maximum. If you do, your insurance carrier will take on the remainder of the bills for any covered in-network services until your plan resets. Now, regardless of what type of plan you choose on the marketplace, all plans must offer the 10 essential benefits. The 10 essential benefits are ambulatory patient services, emergency services, so if you have to go to the ER, hospitalization, any type of inpatient care, pregnancy, maternity, and newborn care, mental health and substance use disorders, prescription drugs, rehabilitative and habilitative services. These type of services would help you to recover any type of physical or even mental skills that you might need. Laboratory services for tests, preventative and wellness services, as well as chronic disease management, and pediatric services. Plans also have to include birth control coverage and breastfeeding coverage. Plans may choose to offer additional benefits to entice beneficiaries, but make sure to compare the actual cost and value of these benefits so that way you're not lured in by a plan that may not actually be the best plan for you. For example, let's say you're looking at two very similar plans, but one happens to offer dental coverage, but that plan is $100 per month. Is that $100 per month difference really worth it? Well, maybe not, because in all honesty, you could likely get a dental add-on the marketplace for much less, or even private dental insurance, which would give you access to a PPO plan for less, or maybe at most that amount. So definitely make sure to compare those additional benefits and make sure that they are in fact worth the extra money that you're spending. Now let's talk about those oh so confusing metal tiers. There are 4 metal tiers for marketplace plans. There is bronze, silver, gold, and platinum. And despite what you may think, the names of these tiers actually have nothing to do with the quality of the plans themselves. It really only has to do with the cost-sharing structure. So generally speaking, a bronze plan will offer you a 40-60 split, wherein you'll pay 40% and your insurance will pay 60%. For silver, it's a 70-30. For gold, it's an 80-20. And platinum, a 90-10. So these are co-insurances like we had just talked about. Now that's usually how it breaks down, not always. So let's talk about a couple of things that you should take into consideration. Bronze plans will usually have lower monthly premiums because of those higher co-insurances. Now these types of plans might be better for someone with more limited medical needs who's looking to save money on their premiums. Then there are silver plans, which are basically one step up if we're talking about cost sharing. Silver plans are great for people who are eligible for those extra savings through premium tax credits and silver plans. Because yes, if you are eligible for a premium tax credit, you may notice a pop-up that says you're eligible for additional savings with silver plans. So if that's you, definitely make sure to take these plans into consideration. Then there are gold and platinum plans. Generally speaking, they will have higher monthly premiums because of those much lower cost shares. So this might be a plan for you to look into if you're someone with more significant or larger medical needs. When you're sorting and filtering on the marketplace, you may notice a special benefit called an HSA. An HSA is a health savings account, and they are only available with HDHPs, which are high deductible health plans. So what does this mean? Well, a high deductible health plan is just that. It's a plan with a higher deductible, but specifically it's an amount set by the IRS every year. So in 2024, the minimum deductible that any plan can have to be considered a high deductible is
$1,600 for an individual and $3,200 for a family.
And then the IRS will also set maximum contributions for an HSA. So in 24, the maximum contribution for an HSA,
$4,150 for an individual and $8,300 for a family.
But let me go back just a few steps. An HSA is an interest-bearing account. It is your money, and you are able to contribute that specified amount pre-tax. You can then withdraw money from that account for any qualified medical expense, and if you do so for a qualified medical expense, then that will no longer be taxed as well. And truly, the list of qualified medical expenses is quite long. It even includes things like over-the-counter medications like Advil. So don't worry if you're concerned that you won't have something to spend that HSA on. Yes, you most certainly will. But you don't have to spend the money in that HSA. You can continue to let it roll over from year to year. And as I said, these are interest-bearing accounts, and that interest is also not taxed. And if you manage to hold on to your HSA until you turn 65, then you could convert it to a basic retirement account. So why would you consider this type of plan? Well, number one, you might consider this type of plan if you are on the cusp for qualifying for a premium tax credit. Because if you contribute a certain amount to your HSA, that lowers your taxable income. And if you're somebody who's on the cusp of maybe qualifying for a premium tax credit, and now you can lower your yearly income by $1,000 or a couple of $1,000s, you might just push yourself into a low enough tax bracket that you would now become eligible for those premium tax credits. And that can save you thousands of dollars per year. You also might want to consider an HDHP with an HSA if you're someone who considers yourself pretty financially savvy, because HSAs are very, very popular in the FIRE community because of that triple tax advantage. So you are lowering your taxable income by contributing to the HSA, and the interest that is accrued is, of course, non-taxable. If you withdraw for a qualified medical expense, that's not taxable. And you can even invest a certain portion of your HSA, and that money is not taxable. You might also want to consider one of these types of plans with this added benefit if you're somebody who would work well with a high deductible health plan, namely an individual with limited or lower medical needs, because you don't really want to be somebody that has extensive medical needs and then you have to meet that high deductible. If you run the numbers, then it may turn out that that's not really advantageous to you. So really, high deductible health plans are best for people with very basic or limited medical needs. If you're somebody, maybe someone that has young children that are more likely to go to the doctor frequently, get sick more frequently, or possibly injured, then maybe a high deductible health plan isn't the way to go. If you're someone with extreme medical needs who is certain to meet that deductible right away, make sure you run the numbers because it could work out in your favor or possibly not. Generally speaking, our recommendations for people with higher, more extensive medical needs would be for plans with lower deductibles, lower out-of-pocket maximums, but we hate to make any type of blanket recommendation without having a one-on-one conversation. Now let's talk about the types of plans themselves, namely HMOs, EPOs, or possibly PPOs. So on the marketplace, it's unlikely that you're going to find a PPO. Usually we're just talking about HMOs and EPOs, but we will talk about PPOs in just a second. HMOs tend to be the more cost-friendly option. They'll have lower monthly premiums, but much less flexibility. So you will need a PCP, which is a primary care physician, and you will need a referral from your PCP to see a specialist if needed. And of course, you are only covered in-network, except in the case of a true medical emergency. Then there are EPOs. These are also often offered on the marketplace. EPOs tend to have slightly higher monthly premiums and a little bit more flexibility, although not as much as a PPO. So you'll still need a PCP. Basically, you can still only go in-network, except in the case of a true medical emergency, but you won't need a referral to see a specialist. Now, the problem with these types of plans is that they're really not best for those who are looking to travel extensively. So in this day and age, being a digital nomad is more popular than ever. And if that's the case, then you may want to look into a PPO. A PPO doesn't require a PCP, it doesn't require a referral to see a specialist, and you can go in and out of network. And of course, they do tend to be more expensive, but if you're on the road quite frequently and maybe you don't even have a home base, then a PPO might give you the flexibility that you need. If you are someone who absolutely needs a PPO, then you may need to look into private insurance. Which brings me to my next topic of discussion, which is private insurance, specifically short-term medical plans. So private insurance is of course going to be more expensive than plans on the marketplace. However, if you are someone that doesn't qualify for a premium tax credit, then they might actually be comparable. For example, let's talk about those short-term medical plans. Now, short-term medical plans, unlike marketplace plans, do have medical underwriting, which means you could be denied or charged more based on a pre-existing condition. For the most part, you're not going to be denied based on a pre-existing condition. It's just usually not going to be covered in the first year of a multi-year plan, although if it's a more common condition, then very often it will be covered in the second or third year, because you can usually get a short-term medical plan for a period of up to 3 years, which is not really so short-term. Now, medical underwriting means that short-term medical plans will likely be more expensive for people with more extensive medical needs, but on the flip side, they tend to be much less expensive for younger, healthy people with limited medical needs. So if you are someone who needs a PPO, who is a younger, healthier person, or maybe somebody who's ineligible for a premium tax credit on the marketplace, definitely look into short-term medical plans because they do offer you that nationwide PPO coverage and they allow you to more so pick and choose your benefits to make sure that your plan is tailored for your needs. These plans are not available in all states, so it may not be an option for you depending upon your state. They're definitely not great for people with younger and small children, and they're not going to work for somebody who is pregnant or wishes to become pregnant because they will not cover pregnancy. So I know that was a lot of information, but hopefully it's given you a good jumping off point to find the best healthcare plan for you in 2024. Now, if you do have questions, and I'm certain that you may, please feel free to reach us in the comments below or at the number on the screen. As always, thank you so much for watching and have a wonderful day. Bye-bye.
Before you go, make sure to click that like button and subscribe as well. And if you want to learn more about those 2024 marketplace plans, make sure to check out this video as well. We'll see you next time.